CBD. So in conclusion, it's safe. There's little side effects, if that, better than conventional medications. It helps with inflammation, improving immune system, and really you have to understand it's supporting the healing and repairing response. So it's not just like, oh, when people think of cancer, it's killing a cancer cell, or it's blocking this. It's actually stimulate your system to do that. And so that's what people understand, that you have to take it consistently, you have to take it over time. And then once you take it over time, you'll notice that even more and more benefits. Don't expect to happen like, oh, I'm taking a pain pill. You can take a turmeric product and bam, you can notice like within 30 minutes an improvement of the inflammation. But we're talking about repairing mechanisms that are ongoing and long lasting. So I just really, if we have, let me see, can I have a little bit of time for just one case study?
This is Kim, everyone. I'm in the little square here. So we do have a bunch of questions, but why don't you guys chime in? Do you want a little bit more on this case study? Do you want to dive right into questions? I'm looking at really focusing on clinical questions, and we've got a couple that I can see. So maybe would you mind if we leave that screen up, and then I'll just ask you at least one.
I mean, people can read it if they want. Basically, what I want to just show you is that with traumatic brain injury, we can see within a year, especially if you get scanned. So that's the benefit as, like if you work with an MD, you work with someone who's an integrative, and they're really, and you have a great rapport with them. And it's like where you can share the patients, you can document, because we actually can show regeneration of neuronal tissue within a year after severe brain injuries now. So we have people have stroke, we have people from traumatic brain, and they look like, like the brain's either shrunk or there's actually sections of the brain that's damaged through lack of blood, or a clot, or all this other stuff. We can actually brain is neuroplastic, as you saw, brain-derived nerve growth factors and oligodendrocytes. We can regenerate those tissues, so you can actually do that. And if you use that in conjunction, say, with an acupuncture, especially neuroacupuncture, what I really recommend, we can see wonderful things that, if you were to ask me 10, 15 years ago, I'd say there's no way, that could be happening. And now this, to me, it's like every time we see these patients, like, yeah, we have a chance of recovery, and we have improvement of function, definitely, in most, if not all, these patients.
Great. Yeah, so like Ron and I were saying, this could be a 6-hour lecture. I think everybody probably agrees with that. You packed in a ton of information. Did you want to talk about the book here?
Well, yeah, I'm not. I just want to say it's here. I don't want to be the CME thing. So, but what I would recommend is understanding that if you understand inflammation, and I've written a book here, and it's all evidence based. So you'll see like 1,500 references to all the clinical studies and data that supports what we're talking about. It's all about, I'm a natural person, so we look at pretty much what you'd be using or things that you'd already be thinking about in your practice. But how do we explain it to our patient, and what is inflammation looking at from head to toe? Anywhere that has itis is inflammatory, gastritis, colitis, arthritis, dermatitis, prostatitis and stuff like that. So there's 200 itises. We have to look at what are the triggering mechanisms. So it's always about looking at foods, gut, inflammation, immune system. And one of the things that I always recommend is using CBD as part from hemp oil as part of an overall anti-inflammatory approach, along with diet and lifestyle for improving health conditions.
Okay, great. So I'm going to dive right into some of these questions. So there's one from Diane B. One of my patients recently experienced serious heart flutter after topical use of CBD. It lasted more than an hour. Any research or input on this reaction?
I would not know why that would cause the flutter. However, if there's anything else in the topicals, then that, because what everybody's trying to do is either they put other chemicals in there, or they're trying to see, can we enhance the absorption of it? I don't think there's enough data to say that. In terms of heart flutter, I've not seen that. However, with the THC, believe it or not necessarily with the CBD, but with THC, we have seen, because a lot of people go get salves from the, because I guess California, since it's legal, they can get like stronger salves that are just like taking the cannabis plants and mixing a high THC CBD salve, and we do see that there can be like a hyper response. So even though most people, the more THC, they become more sedate, they get more sleepy, they get tired. They can't really overdose per se. They just fall asleep. But we do see some people actually have there's about, now this, we're talking about genetic SNPs and things with that, is that we can see that some people actually get an excitation. So it might be something like that. But I'd be more concerned about what was in the salve, like topically, because topically you shouldn't technically get a heart flutter. I've not seen that clinically in thousands of patients. But remember, everybody can be uniquely different. I wouldn't say that's something really due to CBD. It may be more due to something else that might be in the product.
Okay, great. And then we've got one on anxiety. Karina has a question. I've noticed a paradoxical effect on patients using CBD to treat anxiety. Any insight you can offer be great. Please include functional tests that could help screen for possible metabolic issues.
So the patients that we see some of the paradoxical issues is, and if that means that, what does she mean by paradoxical? I just want to make sure that when she's saying that.
I'm wondering, Karina, if you can chime in, but am I guessing that they're having anxiety symptoms?
It makes it worse?
Making it worse?
There is a small case of that. So one of the things that we see is that people that have, especially when they use full spectrum, and especially if they use cannabis just from the dispensary, because now they can get it everywhere. Like say in California, people don't even use hemp oil. I was like, I just get the stuff at the dispensary because it's cheap sometimes, right? Because they're just making so much cannabis products. People that have trouble with that detoxification, so some of the MTHFR testing, if they're MTHFR positive on any level of any of the enzymes, we know that they have trouble with detoxification, and through that aspect, that will actually, it just makes them feel weird. And again, 10% actually have a hyper response. Instead of being sedative, they get excited. So that's why I always, again, starting low and go. So when I say starting low, sometimes like if I'm giving a tincture, I might even start with 5 or 6 milligrams. And people are like, what? And I'm like, yeah, that's what it is. 5 or 6 milligrams, 3 times a day, not bedtime. And because remember, you're trying to stimulate the system to turn on. You're not trying to overbound it. It's a key in the lock of the immune system. You just need a key to get in. You don't need a bulldozer to knock the door down to get into the house. And it's not, dose response curve does not respond to that as well. In fact, there's some studies showing bell-shaped curves, but even in the bell-shaped curve studies, they were talking about healthy patients. And that's why they had to take a huge dose to get to the benefit, and then it dropped off. We're finding out most people that you'll see who are patients that actually have active problems, less is always better.
And so when you say that, 5 to 6 milligrams 3 times a day,
Mm-hmm.
how many, days or weeks would you put them on that to see the results?
I usually start off with, I usually give it like 10 days first, right? And it see just how they tolerate it. Sometimes we recommend people like doing a journal because here's the thing, half the patients are going to have some kind of fear just because it says cannabis, hemp, all the political issues, all the things that we grew up for, years, and that drugs were bad and blah, blah, blah. So there's a little bit of a, there's a psychological part of fear. There's also another part of the people want to actually get high because it's a legal way that they could, and they never want to. But everybody has this underlying I didn't get a buzz, and I was expecting something. Well, you're not if it's broad spectrum, So everybody has. So I always start off low, and I always tell them that journal how's your sleep, how's your digestion, how's your joint muscle pain, how's your anxiety or your focus and all. Because most people will start feeling sometimes people say I feel really tired. Or if they're taking a small amount, but then they usually have super high anxiety. So they're just understanding that's what it means to feel to be calm, and their perception is I'm sleepy because they only feel calm when they're sleeping, when I'm resting. So that's I always do that for about 10 days, and then I go up weekly. I'd have them take it for about a week or two, and if they log on a scale of 1 to 10, I use a lot of 1 to 10 scales, or the little pain scales. If they have pain little faces, you can do the Wong-Baker pain scale thing on Google. You can just type it up, pain, and that gives you are you happy, are you unhappy, are you pain, where's that's universal that everybody responds to. Then you can see on all the levels, digestion, sleep, if it's getting better, then you keep increasing the dose. Now once they don't get any fuller benefit, and say they have a side effect, or they're feeling it too much, then you go back down. So sometimes you have to dose up, and then if you're not getting any more benefits, then you dose down, because the idea is you want to get the lowest dose possible to create the physiological effect. Just like with any medication, with any herb, more is not better. We're trying to just get the body to do what it needs to do.
Yeah, I was just going to say, I mean, with Chinese medicine, it is so much like that, where you're constantly, with every visit, you're constantly, evaluating and changing. And
Yeah, and it's about balance, and so a lot of it's not about suppression. So it's not like traditional drugs. We block this receptor, we're suppressing this, or we're knocking this out, and that's why it takes a little longer time. Because when a lot of people come in and say they have like rheumatoid, right, or MS, and sometimes they want this, they hear about cannabis, they hear about CBD, hemp oil, and they think like it's a miracle they're going to take it. It's like, no, how long have you had this thing, this condition? 20, 30, 40 years. It's going to take a little time, because you're talking about repairing something. It's like now, like if the wall was broken and now you're calling the Army Corps of Engineers. Well, if it's been broken for 30 years, there's a lot of bricks and things that they have to build back to structure, but it does it. There's no drugs that do that. So I always look at, can we stimulate the body's innate ability to heal, which it does have? Yes, and this is one of the attributes and things that I strongly recommend, because on top of the diet and lifestyle and stress, this is something that is, again, doesn't have really a large side effect profile. It is easily accessible to everybody, and it's not, if, obviously there'll be some percentage of patients who may not be able to take it, but almost I would say about 90% of my patients now that come in, it is something that I offer them, because they will come in with some type of inflammatory issue.
Right. And I think that, you were discussing patients, that the majority of your patients are reducing or eliminating prescription medication. And that is such the goal, right? When they come.
Yeah, always. And so I think the biggest challenge right now is that people take too much of CBD. Okay. Doesn't matter broad spectrum or full spectrum, but they say too much and they say it didn't work. And I think for most of the people who are listening online, the practitioners, is that there's still a fear, and especially in a certain demographic of patients, right? That this could be dangerous for me. So they wait all day until they get home, or their pain's really bad, or they can't sleep, and they're really, now they're really irritated, and then they take a lot of this stuff, and then it doesn't really work well, and then they feel like, well, it didn't work, and well, how often do you take it? Well, I just take it once or twice, and I took a drop or two or three, and then, it's not going to work that way. You have to start like, I sometimes tell them like, you might only notice anything. Take it. It's like starting anything. It's like when you're working out, you just can't go to like 50-pound weights or something. You start off with like 2, and it's like, well, I can do this all day. I'm like, good, but you're not gonna be sore tomorrow. Then you go up to 4. So you keep adding those things over time, and that's how you have to kind of explain it to the patient. Otherwise, I think they just jump too fast and they're overshooting the receptors, and that's what we've seen with most of our patients. They overshoot receptors.
Okay. I just saw that your image disappeared, but we can still hear you. So I'm not sure if everybody else is seeing that.
I see. I'm back now. I don't know what happened. I didn't do that. So the other thing that someone said something about neuroacupuncture. Since this is the CSOMA, I do want to mention something called neuroacupuncture. There's a neuroacupuncture institute. It's nonprofit. You can get trained in something called neuroacupuncture. Just go there. You can see the videos. You can see the things. Dr. Jason Howe is the 3rd ranked acupuncturist of all China right now. He wrote a famous book on scalp acupuncture. He's from Harbin, and has been, they've treated everybody. There's going to be a Netflix documentary coming out hopefully the end of next year. The guy who did 9,000 needles, he's filming this one for us. And so, Parkinson's, MS, stroke, TBI, autism, and cerebral palsy, phenomenal. Nothing better than that. Okay. And most people, meaning 99% of everybody in America, even if they're Chinese, they didn't learn. It's a different type of style of the technique of how they put the needles in. It's very easy to learn. And we've already just graduated our first 62 acupuncturists and DOMs just about a month ago. It's about a 3-level course, and every time they do demonstrations and do this training, it's usually here in Albuquerque or Santa Fe. But something that's to add, because if you want to like jump even further in the level of your, even if you're doing acupuncture for 30 years, we have people on our course who've been doing acupuncture more than I've been practicing medicine, and it's like, but there's just there's always like another technique, just like everything that we're learning. If you can add something that has an immediate effect, an enhancing effect, then when you use that in addition to, so what I do is I do the neuroacupuncture to get them this immediate boost, but I'm starting the CBD to have this long-term like benefit of keeping those benefits from the acupuncture sustained.